The president finally agrees to be seen in public wearing a mask, and it came during a visit to the Walter Reed Military Hospital here in Washington earlier today. Meanwhile, spiking numbers are being seen across much of the country, especially in states that rushed to reopen. Joining us now, Dr. Patrice Harris. She's the immediate past president of the American Medical Association, and Dr. Jeremy Faust. He's an emergency room physician at Boston's Brigham and Women's Hospital. Dr. Faust, yes, the president wore a mask on camera today. We've all seen the picture now, but what do you make of him saying it made sense in a hospital setting to do so, and not that it makes sense necessarily whenever you're around people, because when he is around a lot of people, we never see him wearing a mask?
Good evening. When I see the images of the president wearing a mask, I welcome it. That's the first thing. Better late than never. What he does ripples down. People see that, especially in his coalition, and they say, if the president is doing so, I should do so. We need to make wearing masks patriotic. Let's make America safe, and that's good leadership, and I'm glad to see it. Hopefully it'll spread to other activities as well. No one's immune from this virus. I think we've learned that. We've gambled. We opened early in many places, and when you gamble against this house, you don't win.
Because thousands of Americans, Dr. Harris, will live over the next few months if everyone in the country starts wearing a mask right now, which unfortunately is not happening, right?
There is no question about that. Well, if we are 6 months into this pandemic in this country, and we are absolutely headed in the wrong direction with the recent surge in cases. We see long lines to even get tests, and then you can't get your results for days. And we also see a worry about the ability to get PPE now. This is something that we were talking about 4 months ago. So we know that the one tool we have in our toolbox that we know works is wearing masks, in addition to making sure we are staying 6 feet apart from one another. So it is so important that everyone wears a mask.
You know, it's so interesting, Dr. Faust, because you're an emergency room physician. You work at a hospital. We see these hospitals across the country right now in the midst of a huge crisis, healthcare workers under enormous strain. What worries you, Dr. Faust, the most?
I worry that we have not learned enough from the past several months. It's one thing to say we didn't know what we were dealing with and trying to make changes in real time, but we just haven't seemed to have picked up what matters. We keep hoping for some savior, maybe hydroxychloroquine, maybe remdesivir, maybe the weather. All of these things have been shown to not matter in a real systemic way in keeping us from having success. We really need to acknowledge that our behavior is the savior. What we do matters. So I do hear doctors saying, what do we do? I'm seeing a lot of people reaching out and saying, wait, how do you handle this virus? And we try, those of us who've dealt with it are sharing as much as we can. I am concerned that I think people continue to believe that just because it happened somewhere else, it won't happen to us. And we need to stop thinking that way. We need to start realizing that we are all at risk.
Yeah, we certainly are. And Dr. Harris, we used to have one huge epicenter. We're talking about the New York City area, but now we have multiple hotspots all around the country. How does that complicate the national response?
Well, certainly this virus, as Dr. Faust said, knows no boundaries. It doesn't respect seasons. And so we have known all along that it was possible and likely that this virus would spread from the initial epicenters. And that's why it's so important to be proactive and to plan to make sure we have enough supplies. But, you know, the one thing that cannot be produced immediately are physicians and other health staff. And so we need to make sure that we do all that we can to be proactive. We are late in the game when we are in the midst of a surge. And so even though we have a lot of states where we are seeing increased cases, I also want the states and the regions that don't have the surge right now to still know that they can become affected as well.
And Dr. Faust, let me ask you about Florida right now, specifically Disney World reopening today. What's your reaction to that?
I think it's another example of how we have people think that opening the economy or opening schools, that those are policies. Those aren't policies, those are goals. And the way you achieve those goals is through hard work. When I've diagnosed patients with heart attacks, and I so often say, they say, Doc, you know, this is a wake-up call. I'm going to make those changes. I'm going to make myself a healthier person. And I look at these things in places where cases are, quite frankly, getting out of control, and I think that they're not that patient. They're not saying, you know what, maybe doc, is the day I'm going to make the changes that are going to make my life healthier. It's going to make my life healthier. So when I see that, I worry that it's not hitting home as a whole community, that we really control this and we can help make it better.
And Dr. Harris, is there one thing you wish everyone would be doing right now in terms of the leadership from the president on down?
You know, it's so important to have consistent messaging. So I, like Dr. Fauci, glad that the president wore a mask today. Clearly, he was in the hospital, so that was certainly critical. But now that message needs to be sustained, and not just the president, really any elected official. So elected officials should be listening to their public health officials, should be listening to their health professionals. That's where we need to drive policy and change based on the facts and the evidence. And so I hope all elected officials wear masks, first of all, model the behavior they expect of others, and then let and allow the science to lead policy, tactics, and strategy.
Let's not forget hundreds of Americans are dying every single day as a result of this pandemic. Dr. Harris, Dr. Faust, thanks to both of you for joining us.